Welcome to another installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that show that talks about all things Gateway Community Health Center, and this show is no different as we got a jam-packed session for you. First off, we head over to our radiology department. We're excited because we have a brand new addition to the team. We're talking about Melinda Molina, Mindy as we call her, who will unveil our brand new mammography machine. Then we head over to our Chief Medical Officer, Dr. Mary J. Cortez, who will touch on perimenopause, menopause, and postmenopause in a segment that both men and women do not want to miss out on. Then we head over to our favorite pharmacist, Dr. Cesar Banuelos, who will touch on all things happening within the world of pharmaceuticals, including GLP-1s and other breakthrough research medication. Finally, we'll head over to dental to talk to Alicia Briceño, Director of Dental Services, who will give us an insight into what patients can expect when they head over to our dental department. We got a lot of show to cover, so sit back, relax, kick your feet up, because another installment of Gateway Today starts now. Welcome to another installment of Gateway Today. Well, we're excited because today we are unveiling a brand new addition to our radiology department, mammography. We have added a brand new machine and a mammographer to our team. Her name is Melinda Molina, Mindy as we call her. Check it out. All right, ladies and gentlemen, we are here in our all-new redesigned radiology department, unveiling for the first time our mammography machine here with our mammographer, Miss Mindy, or Melinda Molina here, our mammographer, and the question is cancer, right? But why is it so important that we get screened?
It makes the difference on whether we catch a cancer early that's totally treatable, or we catch it later when treatment is going to be a little bit more intense. Our machine is 3D capable. We don't have to use a lot of pressure anymore. From start to finish, you're looking at about 3 to 5 minutes. There really isn't an excuse. I do over 2,000 patients in a year, and I'll have maybe 2 or 3 that are very sensitive, but at the end of the day, the pressure that we put is as much as the patient can tolerate. So if it's very little that they can tolerate, then that's what we're doing. So this is not painful. It's more of a pressure sensation that they feel.
So the exam is really based on comfort levels?
That is correct. In the state, it does say that the amount of pressure that we are supposed to put is as much as the patient can tolerate. So there's a lot of communication that goes on during these exams, so we make sure the patient is comfortable, and we don't want you to have a painful experience.
I love that. So that, again, puts our viewers at ease when they're hearing about mammography and when they're thinking, man, should I do this, or I'm afraid to do this because it hurts. It doesn't, right?
No.
It's a very comforting process.
Yes.
Now, speaking of that, tell me about the actual exam itself. Off camera, we were talking about 2Ds and 3Ds. This is a 3D machine, right?
This is a 3D machine. That is the gold standard. So that is what you get. And it's exactly what it sounds like. The doctor is getting a 3D rendition of your breast so that he can check it layer by layer instead of just a flat picture like what used to be.
Okay, now tell me about the actual exam itself. How long does it take?
We're looking at about 3 to 5 minutes from start to finish. It does take a little bit more to get you changed and get everybody situated, but from start to finish, once we do begin the exam, 3 to 5 minutes.
So 3 to 5 minutes to possibly save somebody's life, right?
100%. What I do see in the Hispanic culture is that women do put their health last because we have to take care of our husbands, our kids, the house, and there's always something to do. But when this takes so little time, it really does. I do see the difference catching something early. So a lot of people also, what I've heard a lot throughout the years is, I don't feel anything, so I know I'm fine. Catching a mammogram at a stage 0, you're not gonna feel anything. You're not gonna have any sign or symptom that it's happening. So that's why it is important to get your screening. If we do catch it at a stage 0, super easy fix. You're not looking at these crazy treatments. Another thing that I want to mention is that patients think breast cancer and they automatically think no hair, treacherous chemo treatments. When we catch these cancers at a stage 0 or 1, a lot of the times you do not even have to go through the chemo process. It's just quick surgery, easy fix type of situation. It becomes more something annoying that you have to deal with rather than this crazy cancer diagnosis.
And I think that that's the advancements that we're seeing in medicine and why getting screened early is really, really important. At what age should women start getting their mammograms done?
So it is recommended right now that we start at the age of 40. That is when menopause starts happening and when our breasts go through changes, which does happen during the menopause process. That is when cancers develop. So the screening is at 40.
Now, when we start talking about cancer, obviously such a scary word, there's a lot of, I guess, preparation when somebody's diagnosed with breast cancer. You're part of that process.
Yes, I am.
What are the words of encouragement that you share with these patients in that process? Because it's got to be tough on you in that situation.
It was very draining at the beginning, and then I realized I was exactly where I was supposed to be, because I'm happy to be part of that process. And I always tell patients, do not get too far ahead. Like, once you get that recommendation for your biopsy, that's the only next step you need to be concentrated on. And then the following step after that, it's one step at a time, because it's very easy to automatically think the worst, especially when we get so far ahead, like wondering if you're gonna need chemo and all. Take it one step at a time, think of it like a marathon, and at some point you'll reach the finish line.
And I'm glad you shared that, because this is a challenge to everybody out there that hasn't done their mammogram. Your mom, your grandma, your cousin, your sister, your wives, your spouses. This is a challenge to the men watching, to push them to get that test done. And whether it's here or anywhere else, you can get that mammography or that mammogram done. And one last question, Mindy. Tell me about the difference maker this does for our community in terms of time. I know that people were scheduling mammograms and it was taking them such a long time. What are we going to do with this now? What does that do to the time in order for folks to get that screening done?
In our community, it's going to alleviate a lot of the waiting time. Having this available, we're going to be looking at quicker turnovers. So if you do have a screening mammogram, you're not looking at 2 months in advance that you're going to have to be waiting for your appointment. Looking at much quicker than that. Also, if your screening mammogram does come back with an abnormality and you'd have to come back for diagnostic imaging, again, you're not racking your brain and your nerves are getting to you because you're waiting these extended times. We're going to have much quicker turnover times.
Well, thank you for being a part of this team.
Yes.
Thank you for kicking this off for our community.
Yes.
This is an exciting time in terms of serving our population, and we're just thankful to you for all the work that you're going to be doing for this community.
I'm honored and privileged to be here and excited to serve our community.
Well, she's our mammographer here at our radiology department at our central clinic. Her name is Melinda Molina, Mindy as we call her.
Yep.
And if you want more information about mammograms here at Gateway Community Health Center and how you can take advantage of those services, visit our website, gatewaychc.com, or call 956-795-8100. We thank you, Mindy, and we thank you all for watching this episode of Gateway Today.
Thank you.
Well, we're excited to offer mammography and mammograms to all the ladies across South Texas and want to invite you to take advantage of these services right here at Gateway Community Health Center. Our thanks goes out to Mindy Molina for running us through the program and what patients can expect. That said, we're headed over to Dr. Mary J. Cortez, our Chief Medical Officer, to talk about perimenopause, menopause, and postmenopause. And this isn't just for the ladies. Men, pay attention. Well, welcome to this installment of Gateway Today. And one of our favorite guests is on the program because we are talking women's health perimenopause, menopause, and postmenopause. I'm talking about none other than our Chief Medical Officer, Dr. Mary J. Cortez. Dr. Cortez, thank you for being here. Let's start with women's health. I know you have been a frequent guest on our program, and you're a wealth of knowledge when it comes to medicine, but I want to ask you about women's health and the services that we offer for women here at our clinics, all the clinics that we have. What can women do to sort of, if they haven't been to a physician or are thinking about switching physicians or just trying out our clinics, what can they expect in terms of women's services?
Yes, and so we have different services for them. Of course, we establish the care with the primary care physician. We have family medicine physicians and residents, so they can do everything for them, right? In my case, I'm internal medicine, so I will see the patient and refer for the women's services. We offer the pap smear, the woman exam that includes pap smear, mammogram, family planning, STD, sexual transmitted disease and screening, all that. So we offer for the uninsured and the insured. For the uninsured, we have grant services. And so if the patient doesn't have the money or the resources to cover, there's grants that if they qualify, they will be paid for it.
So for women, and talking about women's services, right? We talk about women's exams. We talk about pap smears. When does all this begin for maybe a mother who has a daughter that is thinking about providing these women's services?
Yes.
At what age should a woman begin those women exams?
Well, the counseling starts in the pediatrician's office, right, which we offer. There's a lot of sexual education and how to behave and what to and what not to do. Then after you're 18, you can start with the woman exam. Pap smears are recommended 21 and older. Mammograms when you're 40 and older.
Awesome. Okay, so here's what we're going to do. We're going to take a short little break because I want to talk perimenopause, menopause, and postmenopause. And this is going to be important for you guys watching as well. So stay close. More with Dr. Mary J. Cortez in just a moment when we return from the break right here on Gateway Today.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we were going to be talking about perimenopause, menopause, and postmenopause with our Chief Medical Officer, Dr. Mary J. Cortez. And Dr. Cortez, let me start with perimenopause. What is perimenopause?
So perimenopause is the years previous to the menopause. And usually we start explaining what menopause is. So menopause is the 12 months without a menstrual period. When you have that anniversary, that's when you have menopause. And that's only that day. Before that is the years previous, when you start seeing a declining or a change in your menstrual period and some symptoms. And then postmenopausal when after that day of menopause.
Okay, so it's a lot. Yeah, it's a lot to take in. So, like, what are the signs? Perimenopause, we start talking about this is before actual menopause, right? What are those signs that somebody may be going through perimenopause?
Yes, so we can start seeing it up to 10 years before menopause. So we start seeing it in the 40s and early 40s, right? And you can start seeing changes in your period. It can get heavier, lighter, longer periods, shorter periods. Also, you can get the hot flashes, mood changes, the insomnia, some genital changes like vaginal dryness, changes in the libido, in like the sexual desire. So those things you can see in those years before.
So it's really, so from that period to when we get to actual menopause, so from the perimenopause to the menopause, the menstrual cycle completely stops, and that's for 12 months, and that means that the female has now entered menopause or is now experiencing menopause.
Correct.
Okay, so post-menopause is the day after we realize it's been a year and now I'm in post-menopause.
And you can still see the changes, like the symptoms, right? Okay. Usually perimenopause is more chaotic, they mention it, like the hormonal changes are up and down, that ovary is trying to create the changes so you can have a menstrual period or be fertile. Then in the postmenopausal, you can see the symptoms as well, but like finally the changes in the hormone levels, and like you just showed that.
So for me, I'm just, I'm asking these questions because also, obviously I have some special women in my life, and I'm trying to understand how me as the male who isn't experiencing any of these things, how do we be a support system for our special woman in our lives, whether it be our mother or wife or daughter, whatever. But what is the male's role here?
I think the most important thing is education. We are creating awareness on menopause, so the male counterpart to understand what's going on in our lives, right? So trying to understand what we're going through and support us.
Yeah, I'm glad you're saying that, Doc, because, obviously the men watching, we want to let them know that they do have a role. There is that support system and that they should be educated on the subject. So I'm glad you're sharing that. But one of the final things that I wanted to ask you is what, in terms of medication or treatments, for some of the issues that women are experiencing during these periods, what medications, what treatments are available for women?
Yeah, there's different options, right? The most common and the most recommended is the hormonal replacement therapy, that is with estrogen and progesterone, in some occasions in testosterone. It comes in different options, right? It's pill, testosterone can be topical, it can be a pellet, it can be a cream, right? And it has different options and different indications. So the recommendation is to talk to your primary care physician or your gynecologist. Awesome.
Well, I'm glad you're sharing that information, because not all hope is lost for everybody out there. And then, of course, we have behavioral health counseling also for women that may be having some issues dealing with menopause, right?
Yes, depression and anxiety are common in menopause years, so we have a support for those women here.
It's a full circle treatment for all of our patients, including those women out there looking for those special services. And Dr. Cortez, as always, I love having you on the program. Love picking your brain and getting you to give us the answers that I know a lot of our patients are looking for out there. So thank you for joining us. She is our Chief Medical Officer on Gateway Today. Her name is Dr. Mary J. Cortez. And you need more information on women's health services, make sure you visit gatewaychc.com. Till next time, thank you, Dr. Cortez.
Thank you.
Hey, our thanks goes out to Dr. Mary J. Cortez, our Chief Medical Officer, for highlighting an important topic such as menopause. And of course, the invitation is open not just to the ladies, but to the men to understand this topic a little bit more after you're done watching this program. That said, we're headed over to pharmacy with our favorite pharmacist, Dr. Cesar Banuelos, who will give us the latest and greatest when it comes to everything from GLP-1s to the latest research when it comes to medications. Check it out. Well, we're back on this segment of Gateway Today, and we are talking pharmaceuticals. We're talking about medications, but specifically here with Dr. Banuelos from our pharmacy department, or our pharmacy, we're talking about GLP-1s, semaglutides, right? These are medications known to the general public as the Ozempic and Wegovys of the world. Not focused on weight loss management, because everybody's wondering about the wonders of weight loss, right? I take a pill, I lose a ton of weight. Really, these were medications that were developed to treat type 2 diabetes, but we've seen, this is great news, it also can serve as a weight loss or studies for weight loss. So tell me about these new studies, Doc. What's happening there?
So I guess the most recent announcement Novo Nordisk made was that they looked at semaglutide at a higher dose of 7.2 milligrams. And so previously the highest that you could get was 2.4 milligrams. And to do a comparison as to how much weight loss between them is. So for example, the highest, around the percentage weight loss, kind of up and down here and there, but 16% with the 2.4 milligrams of semaglutide, and then about 20% with the Nemo, which is the 7.2 milligrams. But tirzepatide is still the one that's only available right now that has the highest weight loss, around 22%, right? And then there's one, I'm waiting for it to come out. It's called retatrutide, and retatrutide is currently one that we've seen that's caused a lot of weight loss, and that's about 24%.
So just so that everybody understands, because I know Ozempic has sort of been the one that has gotten a lot more commercial success, but that's not really the case in terms of the leader in weight loss, right? As per these studies, the one that's really leading is the retatrutide, or
retatrutide, when it'll be available, is probably going to be the king, pretty much. And then tirzepatide, which is currently available, is the one that leads to the more weight loss. And even the newer formulation, the 7.2 milligrams.
Okay. And now, so aside from that, what are these doing for our diabetic patients that may be watching, or even somebody that's concerned that they may be diabetic, don't know, or whatever. But the question is, what do these do for our diabetic patients?
So obviously for the diabetic patients, it'll help control their glucose, right? Very important, right? That's the nature of the disease itself. So we want to bring down that glucose to an appropriate level, 7% or 6.5%, depending on, but obviously there's other percentages depending on how long they've had the disease state for. And then aside from that, the weight loss, but there's other benefits, the cardiovascular benefits, kidney benefits, like we just talked about earlier, right? So all together, they're great medications, and they don't just do that. They'll assist with blood pressure, cholesterol, and a lot of other things. So they're pretty interesting.
And weight loss is just the little cherry on top.
Absolutely. And there was one that I just I looked at recently. Also, is that there's an oral formulation that being looked at, that an oral tirzepatide, so to speak, right? And the people on that study lost 6.8% of their body weight over 28 days.
Yeah. So in a month, I lost 6% of my body fat. Simply by taking a pill. It's coming. I'm telling you, the technology and the advancements in medicine are really exciting right now. And for those that are dealing with type 2, this is an exciting time, because this is helping all of our diabetic patients control their diabetes. But right now, it's still the form that everybody's receiving it is in an injectable, right?
Right. There is Rybelsus, which is an oral GLP. The only problem, it may not be as effective as the injectables, but it is an option available. There is no oral GIP like a tirzepatide, right? But those are coming. We're seeing that happen.
Well, we can see it with the research and with the studies and everything that you're sharing with us, that eventually the hope is that we move away from injectables and just go to a pill form.
Absolutely.
And it makes life a lot easier for everybody, right? Well, more than anything, Doc, I want to thank you for your time, because you're always a wealth of knowledge. You're always staying up to date on the latest and greatest material that's out there. Trust me, I will call on you again, because I know there's going to be some new developments coming up in medications. But more than anything, thank you for your knowledge and your expertise on. It's great to have you on the program. He is our pharmacist and a physician's assistant here at Gateway Community Health Center, Dr. Cesar Banuelos, right here on Gateway Today. He's always a great sport. A big thanks to Dr. Cesar Banuelos for always giving us the latest and greatest information when it comes to medications right here at Gateway Community Health Center. Well, if you haven't been to the dentist, we're hoping after watching this, you'll make that appointment simply by going to gatewaychc.com, thanks to our Director of Dental, Ms. Alicia Briceño. Check it out. All right, ladies and gentlemen, we are here inside our dental clinic here at our Central Clinic, Gateway Community Health Center, with our dental office manager, Ms. Alicia Briceño, to talk a little dental and talk about all the different services available to all of our patients across the 3 counties. And so Alicia, I thought, would be the perfect person to talk to about this because, Alicia, you know, a lot of people have questions about our services. They want to know what kind of services do we offer in our dental department, and you're the perfect person to ask. So tell me a little bit about those services. What do we offer our patients here at our dental clinic?
Sure. Well, first and foremost, welcome to our clinic. Welcome. It's a pleasure to have you here.
Always.
For services, we do offer preventative services. We offer restorative services and oral surgery.
So when we talk about that, when we talk about primary dental care, we're talking about cleanings, right?
Right.
Walk me through that process. Because I'm not the dentist, so you're the expert here, but walk me through that process. We can see any age group in here in our dental department, right?
Right. So we do take children and adults, starting from 6 months and up. Preventative services, basically what it is, it's, your exam, x-rays, any type of preventative care, dental sealants for children, oral hygiene instructions as well. So yeah, that would be part of the preventative.
So kid comes in with a cavity, a toothache, you guys can take care of it here.
Right, yes.
Okay.
So that would be a restorative treatment. So we also go through we do the restorative treatment for those patients that need the treatment,
Now tell me about the different type of equipment that's available. You mentioned the x-ray. We can really get down and deep into the root of the tooth to really find out what the cause of pain or problems are within our patient's teeth, correct?
Right. So we do have our panoramic machine. We have a 3D panoramic machine as well. We do take bite wings and PAs depending on what the patient needs are. We either just focus on that specific tooth that the patient is coming in for pain, or they need a whole evaluation as for the whole mouth. Like, it just depends on what the patient's needing for that visit,
And we take all patients, right? So it doesn't matter if they have insurance, because I know that's probably one of the questions. I don't have dental insurance, or I have private insurance. I don't know if I can go to Gateway.
Right.
We take everybody, right?
We take everybody, uninsured, insured, anyone basically. So it's a one-stop shop basically for every
and I love that you mentioned that because, overall health begins with oral health. And, for our diabetic patients, for our patients that maybe have not seen a dentist in years, you guys can take care of them too, right?
Exactly, yeah, anyone.
And, really quickly, I know one of the big questions that a lot of folks have is sterilization or cleanliness, right? And as we kind of look at the equipment, I'm noticing that it's all in plastic, it's covered. Tell me about this process.
Yes, so basically the whole dental department, it's a sterilized environment. We use all of our instruments that we use with each patient, they go through the process of sterilization after each use. So we make sure that we have, the staff well knowledgeable on that process to make sure that we are in compliance with that.
Yeah, and I'm glad you mentioned compliance because we're proud Joint Commission accredited, meaning that we are accredited as an institution for our sterilization process and our cleanliness. So that's a great thing. And finally, just for the patient that's nervous out there, that's maybe uneasy about coming to see the dentist, how do you all kind of prepare them, like from the kids to the adults? Everybody gets nervous when they're going to go to the dentist, right? How do you prepare them to see the dentist?
So for whatever reason, I don't know what it is, adults are the ones that usually come in with, a lot of anxiety. And we always try to have that communication with the patient on a one-on-one basis. And we guide them through the whole process of the appointment. It requires a lot of listening to what they need and what we're gonna offer to them. And yeah, it's just basically having that open communication with the patient throughout the whole process of the appointment.
I'm glad you mentioned that because sometimes our dental department can also be a listening ear or a shoulder to cry on, and I'm glad that you're doing all of that. You guys are doing an excellent job here in dental. And if you want to get more information about our dental department, you can go to our website, gatewaychc.com, or you can call 795-8100, area code 956, to get your appointment going. You can come visit with Alicia and the rest of the team here, and they'll get you onto a brighter, healthier smile right here with Gateway Community Health Center. Thanks, Alicia.
Thank you.
Hey, a big thanks goes out to Alicia Briceño, our Director of Dental Services, for running through what patients can expect when they visit the dentist here at Gateway Community Health Center. And remember, if you are not a patient at Gateway, don't have insurance, Medicare, Medicaid, we accept everyone as a patient here at Gateway. Simply call 956-795-8100 or visit our website, gatewaychc.com, to become a patient today or set up your next appointment. That said, if you want to catch a full rewind of this episode or any of our other Gateway Today episodes, head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you for watching this episode of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.